All right. Well, for the just being sensitive to everyone's time, we're going to go ahead and get started. So I wanted to welcome everyone for coming today. Just thank you for being here. I'm Diane Riley. I'm the Chief Operating Officer here at Carson SAINT. And I have the pleasure to introduce to you Connie Seal. Connie is our Director of Services, and she is a certified HIPAA professional and holds many other certifications. So Connie's going to talk to you about what's news in the world of HIPAA. So Connie, take it away.
Thanks. Good afternoon, everyone, and welcome. I have been in the cybersecurity business for over 30 years. I've got experience from hospitals to CCRCs, multi-practice offices. Plus, I fill the role of HIPAA security officer for covered entities. Now, as a working practitioner, I always like to say HIPAA is my favorite. I always also say I love my job, and I get teased a lot about that. But the reason I love HIPAA so much is because you are helping to protect healthcare organizations. And what do? They take care of people. Then you're also helping everyone who's working in that healthcare environment and all the patients. Then when you flip it over, you could be the patient. Your family members could be the patient. People you're friends with could be providing the care. So it's a double win-win. It's definitely a win-win, and it makes it very fulfilling personally and professionally to work with HIPAA compliance. The other point that I wanted to make, an opinion that I have, is even though the title is compliance with Connie, and I genuinely value compliance, we all know that compliance does not equal security. So as a cybersecurity advocate and an experienced leader, active cybersecurity practitioner, I submit to all of you that we need to be secure first, and then by default, that will make us compliant with most every standard. I also believe a short intro is the best intro. So let's get to these details. Actually, this should be really exciting because there is a lot of news in HIPAA, and it is quite a bit to cover. I thought I had 30 minutes and was going to run over. And the good news is Quinn looked out for that and he scheduled it longer. So we should have time for everything. But there's also a lot of details that back up these slides. So I've provided the links at the end of the presentation so that you could look them up and read as long as you want. So let's talk about what is news in the world of HIPAA. Today happens to be very exciting because normally HIPAA does not evolve quickly, but in 2021, in the first quarter, I have so much to tell you, I probably can't get it done in 30 minutes. And this promise of progress, it's moving forward in leaps and bounds in 2021. So there's 4 topics. The first one's going to be proposed changes to HIPAA that will likely be implemented later this year. The second topic includes changes to HIPAA that address COVID-19 and what they've done to make it easier to deal with this pandemic. Third, we'll talk about HIPAA penalties. There's been some flip-flopping on what was originally intended, and it's been adjusted, and I'll share that with you. And then lastly, the best part, you always have to save the best for last. The best part is that there's something out there called 405D, and this information is targeted directly at the healthcare industry and will make healthcare providers more secure and will protect our patients. So let's get going. Okay, this particular graphic, I want to give you some foundational information. This is a timeline, and I'll talk about the timeline in a second. This timeline falls under HIPAA and what they're doing. So HIPAA started in 1996 when it was introduced. And there's been updates over the last couple of decades. And the last big update really was in 2013. HIPAA released the long-awaited omnibus rule, the final rule. And what that did was expand HIPAA so that business associates who work with patient medical records and their subcontractors are held accountable for securing the data. It modified the breach notification standard. There were expanded patient rights and access to restrict disclosure of their medical records. So these new imposed rules governing uses and exposures, along with a few more other changes, were most of the privacy and security provisions of the HITECH Act. So since 2013, we've been waiting for change. And I think once we get through this presentation, you'll have this excitement about how HIPAA is coming forward, as even in this first quarter of 2021. So to discuss this chart and why I'm excited about what's going on, there's five major milestones on the chart, the black diamonds. And the first thing that happened was the Office of Civil Rights, OCR, they issued a request for information. On that request were 54 questions. They were looking for input on how to support individuals' engagement in their healthcare, how to remove barriers from coordinated care, how to decrease the regulatory burdens on the healthcare industry, and do that while continuing to protect the individual's health information privacy interests. So that was December 2018. The second milestone hit when the period for comments was closed. So the request for information could be answered by anybody, and they closed it. That's when the longest phase occurred. It ran from February 11th, 2019 to December 10th, 2020. And many of the proposals in this document, called the Notice of Proposed Rulemaking, were in response to that RFI from 2018. So now for the exciting part, this long golden box in the middle has passed, and we hit the third milestone on January 21st this year. OCR published the Notice of Proposed Rulemaking in the Federal Registry. And this fourth milestone was slated to end on March 22nd. However, in early March, they decided to extend this period for the public to comment all the way until, excuse me, May 6th. So you'll see that as the fourth milestone. And some of the changes that were, excuse me, that were proposed were strengthening individuals' rights to access their own health information, including electronic information. Think about your patient portals. Improve information sharing now for care coordination and case management. And they were also facilitating family and caregiver involvement in care of individuals who are experiencing emergencies or health crises. And finally, enhanced flexibilities for disclosures in emergency or threatening circumstances, such as the opioid crisis and our COVID-19 public health emergency. They also were trying to reduce the burden on HIPAA-covered entities, which are your healthcare providers, as well as health plans. So we'll have to wait now. Get your comments in. You too can respond to this Notice of Proposed Rulemaking. It's out there. It's public. I've got the link at the end of the slide deck for you. But it's possible that we could still get some of these changes implemented before the end of 2021. So the next 3 slides go into levels of detail about the changes that may occur this year. So I'm going to walk through those. It's a lot of information. So please, understand there's way more out there than I even put into the presentation. For example, I love this first one. To me, as a patient, this is very exciting. And for my family, my friends, this change would allow a patient who is present in the doctor's office and looking at their own x-ray with the doctor or their MRI or their sonogram or even lab results, they would be allowed to use their smartphone to take a photo and they could immediately email it to their spouse. So this allows patients to inspect their charts and test results in person. They can take notes, they can photograph it, and I think that's a big exciting change to the patient care. Also with patient care, we're talking about a change that would provide individuals their own electronic protected health information at zero cost. So there are times when, you have a number of doctors working for you and the doctor adds a health note. Well, with this new proposed rule, that health note about one individual in that electronic health system can then be provided to other doctors, allowing for that individual patient record to be just part of the normal course of providing care. One doctor doesn't have to send their notes to another doctor, be it electronically, be it paper copies. So this is exciting to reduce all of that overhead and at no cost to the patient, of course. Number 3 talks about HIPAA covered entities. They are going to be required to put their fee schedules on their websites. Right now, there's confusion, and having the fee on the website will help individuals or patients know that covered entities are charging reasonable rates because it's publicly posted. And then there are also accommodations for asking if the individual wants to request a copy of their record, they can find out in advance what different copy formats will cost. And that way they can take into consideration what's it going to cost if I ask for a printed copy versus an electronic copy, and maybe it would end up being no cost. Number 4 talks about our requirement that an individual can request an estimate of how much are you going to charge me to give me a copy of my own health record. They have the right, and a patient has the right to request for an individual estimate of the fees for copies of their health records. And also they can get an itemized bill for completed requests. So sometimes it's a flat fee, but sometimes it's a little more complicated. And you can get that itemized request to know exactly what it is you're paying for. Again, that makes everything public. 2 more slides of all this new information that most likely will take effect this year. Right now, when an individual makes a request to their healthcare provider for their medical records, that provider has 30 days. They're going to reduce the amount of time it takes down to 15 days. That way the patient gets their records sooner. It's easier access for the patient to their own medical records. So it empowers that individual, that patient, to control the sharing of their electronic health records with their multiple care providers. So a lot of these are uses and disclosures that allow the patient to have better access to their health record, easier access to their health records. Covered healthcare providers and health plans are required to submit an individual's access request to another healthcare provider and then receive back that same request. So that is, again, more sharing of information between the healthcare providers, especially in an electronic format. And this ensures that treating doctors can get the medical records. I think the best way to explain this is through an example. So in this example, there's an individual who is from California, was traveling and involved in an automobile accident in Virginia. They're being treated by a number of specialists, orthopedics, neurologists, they're getting physical therapy, all in Virginia. Now that individual can send a request to one of the treating doctors in Virginia to obtain the electronic copy of the individual's health records from their primary care physician in California, which will assist all the treating doctors that are in Virginia. The Virginia doctor would be required to forward the request within 15 days, used to be 30, and the California doctor would be required to respond to the request within 15 days. So if you're out of your home state and you need your health records, this is a big help for the patient. There is the ability to request an extension, but it's still only 15 days. So you're still maxed at 30. So I also have, in speaking to number 7, there is the ability for an individual to request that a covered entity, their healthcare provider, transmit their health record securely to that individual's personal health application. And if the covered entity has that technical capability, then this form and format is considered readily producible, and that request would be completed. That, again, is kind of like a patient portal that will give that individual quicker access. Number 8, covered entities are now allowed, will be, once this is passed, to disclose PHI if they are trying to avert a threat to health or safety when harm is serious and reasonably foreseeable. So this is a change in just 3 words. The prior words were serious and imminent, and were changed to serious and reasonable. The reason why is for clarity. A lot of people thought that serious and imminent required some sort of a professional opinion to make that decision. So serious and reasonably foreseeable is the new terminology to allow for more sharing of these patient records. Last slide. And there's a couple things here that I am excited about. I hope I still got your excitement going. Covered entities can now make certain uses and disclosures based on their good faith belief that it's in the best interest of that individual. That individual would be experiencing an emergency or a health crisis, could be having a serious mental illness or a substance use disorder. Good faith belief terminology is replacing the word professional judgment. Professional judgment was misunderstood as limiting permission to only persons that had licensed or who rely on professional training to make that judgment. So the good faith belief is based on knowledge or facts of the situation or that that person has of that individual patient. So let me give you an example because they're the best. A good faith would permit a licensed healthcare provider to draw on their own experience with that individual to make a determination that it's in the best interest of, say, a young adult patient who's overdosed on opioids. That healthcare provider could make a good faith decision to disclose relevant information to that young adult's parents. Those parents are involved in that patient's treatment. The provider knows the parents, and the young adult would expect, based on their relationship, that their parents would be involved in the recovery from this overdose. Number 10, this is going to help everybody get better care. The definition of healthcare operations in HIPAA today is only talking about in the office. It doesn't talk about care coordination. It doesn't cover case management. And those are people who may not be licensed healthcare professionals that are providing the care, but they're coordinating the care and they're managing your case. So the proposed exception here would promote beneficial disclosures of PHI for care coordination and care management. And this will really help health plans work to get individuals to the specialists that they need to get to. Another really cool expansion to uses and disclosures. Right now, HIPAA allows for you to share information of the armed forces. It's been expanded to cover all uniformed services. So that would include things like uniformed services, which include U.S. Public Health Service, their commission corps, the National Oceanic and Atmospheric Administration commission corps, and it still includes the armed forces. So a covered health entity could disclose to the U.S. Public Health Service Command authorities the results of a fitness for duty exam of an individual who is a member of the USPHS Commission Corps without the individual's authorization. And of course, the individual would want that fitness for duty exam shared. So they're eliminating the burdensome areas within HIPAA. And finally, I think everybody can be excited about this last number 10. So today, every time you go to the doctor's office, you have to sign and say, yeah, I received the notice of privacy. And what do you do with that piece of paper? And why do you sign for that? So now what they're talking about doing, oh, and additionally, that provider has to keep that for 6 years. Now they're eliminating and reducing, getting rid of all this paperwork that nobody ever looks at. It's important that they do understand the privacy practices that are in place, but just signing and not reading is not really effective, and it is a lot of overhead. So additionally, it's been reported by OCR that there's been confusion. Some people said, well, I'm not going to sign this because they think they're entering in to a contract or waiving their rights to get access to care. And, that's not the case at all. I think the initial intention was just to make sure that you were given your privacy practices and you understood what your rights were with your healthcare information. So that covers many of the proposed changes with the NPRM, but I thought you would be interested and excited to hear what the total savings from these proposed regulatory reforms is. $3.2 billion over 5 years. That's a lot of money that would be saved by making these changes. And I also do have a fact sheet link at the end of the presentation for the notice of proposed rulemaking. All right, we're going to shift gears today. However, I think you're going to share my excitement when you see some of the changes HIPAA turned around basically on a dime to address a nationwide public health emergency called COVID-19. There's 4 of these. They span several slides, but I think This is really exciting news. So the first one, they're waiving penalties to healthcare providers that provide virtual care to patients through everyday communication technologies. That's a lot of words, but we're talking about FaceTime, Skype, Zoom, and Google Hangouts. Now these technologies can be used during the COVID-19 nationwide public health emergency without penalty. They can use these everyday tools to provide telehealth services to patient, even though normally they would not be considered HIPAA compliant. Now they do have a restriction on the TikTok and Facebook Live platforms, but this is a big improvement on protecting patients and getting healthcare to people who need it as quickly as possible. Our next improvement is called an enforcement discretion. Enforcement discretion was written so that there are certain things that won't be imposed that normally are imposed. In this case, they will not impose sanctions and penalties on business associates of the covered entities for uses and disclosures of PHI when they're being used for public health and health oversight activities. So HIPAA normally prohibits these uses and disclosures unless it's specifically written in the business associate agreement that these uses and disclosures are permitted. However, they've quickly made this enforcement discretion during this public health emergency so that they won't face penalties for these types of uses and disclosures of your medical information. They do need to notify the covered entity after the event and within 10 days of making that disclosure. I still think that's pretty good. This is so good that HIPAA is helping us open up to the communities community-based testing sites during the pandemic. In the beginning of the pandemic, it was so hard to get a COVID test. It's gotten so much easier. So what OCR did back in April 2020 was they said they would exercise this enforcement discretion so that the HIPAA rules in relation to the good faith participation in the operation of COVID-19 testing sites, they will refrain from imposing sanctions and penalties to covered entities or business associates at the drive-through, the walk-up, or the mobile sites. And I'm sure we've all participated in one of those. That was a great, exciting change that we were able to get this turned around as quickly as April when the pandemic started. And the penalties are not applied, but they still want these covered entities to implement reasonable safeguards to protect the privacy of the individual that they're servicing. So this went all the way back to March, retroactively. That's a very quick turnaround for HIPAA. Today, there is something called web-based scheduling applications. I'm going to call them WBSAs so that I can get it out and not stumble over my words. But this notice of enforcement discretion occurred January 19th this year, and it was to help HIPAA covered entities with the rollout of the COVID-19 vaccines. Excuse me for that. OCR said that these HIPAA sanctions and penalties will not be imposed because they're going to be using online web-based scheduling applications for scheduling vaccine appointments. So where Normally, these applications would come under scrutiny and not even be considered fully compliant by HIPAA. In these cases, they're helping us get through the scheduling of our vaccination appointments. One more notice of discretion. We're still in the fourth one. This is letter D. It does not cover the use of the web-based scheduling applications for scheduling vaccination appointments if the provider has prohibited the use of those types of applications for making healthcare appointments. So that's just a little nuance. And we have E and F. So these web-based scheduling applications must have privacy and security safeguards that can be activated so that privacy and confidentiality of healthcare data is still intact. So there's a waiver, but you still can't just not even try to keep the privacy and confidentiality. So they're encouraging that the covered entities and their business associates ensure that the safeguards are implemented, such as use of encryption or adhering to the minimum necessary standard, activating all the privacy controls. So this actual notice of enforcement discretion took effect on January 19th, but it was retroactivated all the way back to December. I think that it is so exciting that to see HIPAA in my lifetime turn around quickly and make these changes. And it's great if we need anything like this in the future. We've already got this set up, but it is improving our ability to address COVID as a nation. And I think that's pretty exciting. Just in case you are wondering, this section only has one slide. Might be excited about that. There has been a change, excuse me. The HITECH Act established 4 categories of HIPAA violations. And each of these 4 tiers had increasing penalties based on the level of culpability or negligence that was associated with the particular violation. So I'm focused on the inner circle in the gray, tier 1. This is a person who did not know, and by exercising reasonable diligence would not have known that they've violated one of the HIPAA rules. The tier 2 is an individual or organization, a healthcare organization. The violation was due to a reasonable clause, but it was not willful neglect. Tier 3 is a violation due to willful neglect. However, it was corrected in a timely manner, which may be like only 30 days. Tier 4 violations were due to willful neglect, and they were not even corrected timely. So that is the worst of all the violations. In 2019, the Office of the General Counsel at HHS determined that when they read the HITECH Act, the intention of that act was to set the annual limits, which the per violation and the maximum violations per year in the white rectangles around the circle part of the diagram. They interpreted that the HITECH Act was to apply annual limits that represented the level of the violation. So originally, every single tier had a maximum annual cap of $1.5 million. Now, with the new interpretation, tier 1's cap is a cap of 25,000, and the tier 2 cap is a maximum at 100,000. The tier 3 cap is 250,000, and this is when willful neglect, the violation was due to a willful neglect of that individual, just that negligence. And then the worst violation is still at the $1.5 million. So what happened was, in light of what they determined, they wanted to change the penalty tiers with the annual limits. And this enforcement discretion, notice of enforcement discretion of these maximum annual limits, it's not legally binding. So the OCR is expected, though, to add these changes to the Federal Registry and make these penalty amounts official, likely later in this year. So here's yet another step forward of HIPAA into 2021. If you want more information about high tech and the HIPAA violation penalties, that link again is at the end of the slide. The presentation. So we're now on to the fourth and final topic of the day. It is, in my opinion, the most exciting topic. Wait till you hear this. So this is talking about improving cybersecurity in the healthcare industry. And the exciting news is called 405D. I'm not sure how familiar everyone is, so we're going to walk through this. As a long-term practitioner in HIPAA, it is so exciting to see all this forward motion in HIPAA, and just sit back and watch it all as HHS and HIPAA join forces with industry leaders, technology leaders. They're talking about using vetted and proven guidance and frameworks offered through NIST. They're talking with stakeholders in the healthcare industry and soliciting public opinion, all through this 504D. The long description is Cybersecurity Act of 2015, which includes the Cybersecurity Framework by NIST. And specifically, this one section, 405D, addresses these things that are very exciting. It's bringing together people into the future. So the things that we thought were missing before, which a lot of HIPAA was based on privacy and uses and disclosures, but technology was a little vague. Well, now it's pulling in cybersecurity, and HIPAA's proving itself not to be a stagnant legacy solution standard in the future. So let's dive into some of the details about 405D. It's the Cybersecurity Act of 2015, Section 405D. It was created with the intention to align healthcare industry security approaches. So where HIPAA was very vague, it's pulling in all these industry experts, people that know vetted guidelines and best practices, and approaching the healthcare industry specifically. What was produced is a voluntary process for the healthcare provider. It was built based on a consensus of experts, industry-led guidelines and best practices, methodologies, procedures, and the processes, and the goal being to make it cost-effective to reduce the risk of cybersecurity threats in a range of healthcare providers. Voluntary adoption by the covered entities, the business associates in the healthcare world, and we're looking to put safeguards in place that specifically address cybersecurity threats in the world of healthcare. This is a first time. NIST, HIPAA, the HITECH Act, it's all being brought together by all these different entities, and it's going to make a difference. let's look at the what, the who, the how, the why of this industry-led activity. What is the 405D effort? It's a collaboration led by the Secretary of a collaborative process with the Secretary of Homeland Security, healthcare industry stakeholders, federal and non-federal entities, and they've got the director of NIST included. It's a collaborative process, and these representatives of industry developed consensus-based guidelines, practices, and methodologies that will strengthen the HPH sector's cybersecurity practices against cyber threats. That is the what. Who is a task force of over 150 information security officers, medical professionals, privacy experts, industry leaders, all coming together to work on this. How? The how? How is this going to happen? They have targeted sets of applicable and voluntary guidance built by all the people I mentioned in the who, and the goal is to effectively reduce cybersecurity risks in healthcare, first in a lifetime for all of us. Why did HHS do this? Congress mandated it in the Cybersecurity Act of 2015 in Section 405. But the objective is what's exciting. We're going to strengthen cybersecurity postures in healthcare, in public health sectors. As a practitioner, I know how difficult it is to get a cybersecurity posture outside of IT into the organization as a whole, enterprise-wide. This is going to help us. So the objective is to raise awareness in the HPH sector, provide vetted practices such as existing information and guidance found in the NIST cybersecurity framework. I know as a practitioner, I've always layered in the cybersecurity framework with the HIPAA risk analysis. So of course, I think that's a great idea. They're actually putting this in practice, and that needed to be done, and they're making it happen. Now we want consistency in mitigating the relevant and current cybersecurity threats, which have been researched, and they know what they are in the healthcare and public health sectors. HHS reached out to that diverse set of security experts, both in private and public sectors, and all of these people came together to collaborate and build 405D documentation. Aiding the HPH sector organizations, there are meaningful cybersecurity objectives and outcomes that are available to be implemented by healthcare organizations. And this task group, the 405 task group, they agreed on the content that would be included. There's 3 documents. I gave you the links, a main document and 2 technical volumes. The main document covers 5 threats and 10 practices to mitigate those threats in the healthcare specific environments. Technical Volume 1 addresses small healthcare organizations. Technical Volume 2 discusses medium and large healthcare organizations. We are going to look at, do you know what the first 5 threats are in the healthcare industry currently? These are relevant current threats. And I can honestly say, of these 5 threats, my experience as a HIPAA security officer in the past 6 months alone included the first 4. phishing attacks, ransomware attacks, losing mobile devices, stolen laptops or equipment, internal accidental or intentional data loss, and then attacks against medical devices that definitely may affect patient safety. So these are the current top 5. And what the exciting news is that they are intended to be evaluated and updated at least annually. So they're going to stay current. HIPAA is not going to be stale. On the next slide, these are the 10 practices that an organization, be it small, medium, or large, can use. They've got, whichever technical volume you need to use. I'm going to mute for 1 second again. Don't worry, I'm not sick, but I've been known to talk a lot, but this is a lot of talking. So it's a lot of good stuff to share too. So thank you. Excuse me for that little interruption, but our 10 practices are not new. These things should not surprise you. Maybe medical device security is new, but NIST even addresses that. But we all know about cybersecurity practices in most of these. I know some healthcare providers don't look at vulnerability scanning of the networks. We recommend that vulnerabilities be scanned, networks be scanned monthly, if not quarterly, and annual penetration testing be made. Right now, healthcare is the #1 attacked industry. So there's a lot to be said for all of these practices, but vulnerability scanning will pick out some of those things that are planted when people are getting into your network and planning the ransomware, which is part of the top 5. I'm kind of sad because I think, we're about here at the end. Just to give you some key points from 405D. I hesitate to say the word unprecedented because it's been so overused the past year, but this collaborative effort is unprecedented. HHS is continuing to institutionalize cybersecurity as a key priority. 405D is aimed at various audiences. I didn't get into a lot of detail about enterprise-wide cybersecurity responsibility, but you want your executives along with your healthcare practitioners, your business representatives, and information security all aim being the audience of these practices. 405D definitely fosters information sharing, and it allows for different cybersecurity maturity levels that you face in a very small operation, maybe a single doctor or a dentist's office, to medium and large multi-hospital healthcare organizations. Cybersecurity awareness is critical in today's world to maintain uninterrupted care delivery and patient safety. Even a phishing email can pull so many people away from what they're supposed to be doing for the patient. Certainly a ransomware attack unfocuses everybody from what's important, which is patient care delivery, and focuses it again on fighting this threat, mitigating the threat. So cybersecurity, we need to not treat it as an enterprise issue, as an IT issue. Cybersecurity is an enterprise-wide issue, and it takes all of us to be involved. And 405D is a first step into getting healthcare organizations where we need to be. I think We're all in this together. I'm excited to see these changes. I hope you feel some excitement to see some of these changes. It's so refreshing to see HIPAA flexible enough to handle COVID-19 and relax some of the restrictions. So hopefully you've got enough information. These are the links I promised, and let's all make that difference in making healthcare as an industry more secure. Thank you, guys. Thank you, everyone.
Thanks, everyone. If you have any questions, feel free to unmute yourself, or you can type it in the chat too. Doesn't look like we have any questions during the meeting, but
Yeah, real good job, Connie. I don't have any questions, but you did a great job. I learned a lot about what's going on in HIPAA, and it's good to see that HIPAA is still alive and evolving.
Yes, it is. It's good news.